if you look at the skin microscopically, two of the largest components are proteins called collagen and elastin. And that's really what gives your skin kind of its youthful appearance. And so collagen is a lot of the strength of the skin, and elastin allows it to stretch and then recoil.
Dr. Nicholas Sinclair is a plastic surgeon at Cleveland Clinic. He works with people who have lost large amounts of weight.
With weight loss surgery and with weight loss medications, the amount of weight we're talking about losing can be hundreds of pounds. So this isn't your typical 5-pound fluctuation here and there. These are large amounts of weight. The skin has been really expanded out, and the proteins have really been denatured or really destroyed. So it's not going to spring back, and this can be significant amounts of skin. Skin that you sometimes in extreme cases will see down to people's thighs or down to their knees. Large amounts of skin, extra skin in the neck.
It's not just about looking better after weight loss. Excess skin can cause medical problems.
Common ones we see are rashes and infections, so those could be fungal infections or bacterial infections. Additionally, it can cause issues with just daily functioning. So patients will tell me that it gets in their way when they're doing things like the dishes or folding laundry. I had a woman the other day say that when she turns from side to side, if she moves too quickly, the extra skin almost pushes her over, pulls her over. So it can cause some medical issues as well.
Surgery is what's needed most often.
So non-surgical things, lasers, non-surgical skin tightening devices, they don't work that well in this situation. They tend to be very underwhelming. The most common area of the body is the abdomen. If you imagine somebody who is significantly overweight, typically their abdomen becomes the largest part of them. So that is an area that is very prone to then having extra skin. Now sometimes it may be as simple as just skin removal. Additionally, there may be some deeper work that we do depending on the cosmetic goals of that patient and what the underlying anatomy may be. So that may be more of a typical tummy tuck or abdominoplasty type surgery if we're tightening the abdominal wall. Additional areas that can be addressed are things like the thighs, the upper arms, and then typically we also see changes in the face and the neck. So we might be removing skin in those areas as well. Now typically that will be something like a facelift or a neck lift. And in those surgeries, often skin removal alone is not the only thing. So it will be volume restoration with something like fat grafting. It may also be tightening the deeper layers of the face as well. In people that have smaller weight fluctuations, the cosmetic benefit is huge. In people who have the larger weight loss and a lot of extra skin, the cosmetic benefit is huge, but even just the big changes that they have for their life. They can start wearing clothing again. They're not having to spend an hour doing kind of skincare regimens to deal with the rashes and things like that. And this is the amount of skin that you can't hide in clothing sometimes. So this is really totally life-changing surgery.
For Fox 8, I'm Dr. Marc.